Hi everyone. Now we are going to learn about the movements at this temporomandibular joint. We have 5 movements. One is protrusion, then we have the retraction. So this is protrusion, retraction, then we have the elevation and depression of the mandible, and there will be side to side movements like the chewing movement. Okay. So now, so this is the elevation of the mandible. Like in a resting position, there is no requirement for elevation of the mandible. But when we have like the mouth open, then the mandible has to rise above to elevate to close the mandible, right? So close the mouth. So that is when we need the elevation of the mandible. Then we have depression of the mandible to open the mouth. Then we have the retrusion or retraction. Then this is the protrusion movement. Protrusion movement anteriorly. These are the lateral movements, side to side movements. Okay. So muscles producing these different movements. Number one, depression movement. Okay. Remember, the most important muscle which is causing this movement, that is depression, is lateral pterygoid. Okay. A simpler way to remember this is lateral pterygoid, as you know, has like lots of important relations, important structures in relation to that. Okay. So when we study so many structures, we obviously get depressed, right? So it is causing depression. Okay. Lateral pterygoid means depression. Okay, out of all the 4 masticatory muscles, lateral pterygoid is the only one which is causing depression. Why? Because of the orientation of the fibers. Okay, as you can see here, this is the lateral pterygoid muscle. Okay, and the fibers are going to originate from below. Okay, they are originating from below and it is inserting above to this fibrous capsule and into the pterygoid fovea. So what will happen when it is going to contract? It is going to pull the temporomandibular joint below. Okay, that's how it's going to cause depression. In addition to that, we have certain muscles which is called as the suprahyoid muscles, right? In this picture, you can see this is the hyoid bone and to the mandible and here to the skull. So these muscles, when they pull, again is going to pull the mandible downwards. So we have the digastric muscle, then we have the mylohyoid and geniohyoid muscles helping in the depression of the mandible. Okay, next, apart from this, we have gravity also is a factor which helps in depression of the mandible. Okay, next, okay, what do you mean by depression of the mandible? Okay, what happens when the mandible is depressing? Basically, there is going to be like opening of the mouth, right? So we should know around which axis this movement is happening. It is like really, really important, but it's very simple to understand also. Okay, so for this we will split it into first stage and second stage. Okay, there is going to be less opening of the muscle, then there is going to be wide opening of the mouth. Okay, so depression, okay, mild depression, and there is going to be severe depression, that is mild opening and more opening of the mouth. For example, see, what will happen is there is going to be an axis which is passing through, there is going to be a horizontal axis which is passing through the head of the mandible. Imagine this is the, okay, this is the head of the mandible and this is the ramus of the mandible and this is the body of the mandible, and you have an axis which is passing through this head of the mandible. Okay, now what is going to happen? Depression means opening of the mouth, isn't it? So there is going to be slight opening of the mouth, is going to be like this. So there is going to be rotation around this horizontal axis and there is going to be slight rotation only. Okay, as we already know, there are 2 compartments, like the upper compartment and lower compartment, isn't it? So yeah, so here we have the upper compartment and lower compartment, isn't it? So now if there is going to be only slight opening of the mouth, there is going to be rotation of the head of the mandible, right? So there is going to be rotation of the head of the mandible. For slight opening, it is enough. Okay, but what will happen if there is going to be wide opening of the mouth? Then what will happen is there is slight rotation, then it has to move a little bit forward and then rotate more. Okay, right? For example, here as we can see, initially this is the horizontal axis passing, then it is going to be slight rotation, and then it slides, that axis itself slides forward, and the head of the mandible is also sliding a little bit forward, and then it is going to rotate more. Okay, so this way there is going to be, initially there is going to be rotation and then there is going to be sliding, and then more rotation for wider opening of the mouth. Okay, so this is the different stages of movements happening while there are opening of the mouth. And yeah, so in this we know what was the series of movements happening: rotation, sliding, and more rotation. And now moving on to the next movement, which is elevation. Okay, so elevation, we have rest of the masticatory muscles which is causing elevation. Like as you can see here, number one, temporalis muscle. Okay, temporalis muscle, anterior fibers are vertical, so they are just going to pull the mandible above, easy. Next we have the medial pterygoid and also the masseter muscle, which are all like going to attach into the ramus of the mandible like this. So when they are like contracting, they are going to pull the mandible above. So that's how they are causing elevation. Next we have the protrusion of the TMJ. Okay, for the protrusion, remember in a simpler way as pterygoids. Okay, pterygoids are causing P for pterygoid, P for protrusion. Okay, both the pterygoids are going to cause protrusion of the mandible because both these muscles are like oriented horizontally. So when they are going to pull, there is going to be forward movement of the jaw resulting in protrusion. So pterygoids means protrusion. Next we have the retraction. For retraction, we need some more horizontal fibers coming from behind and inserting anteriorly, right? So that will be this middle and posterior oblique fibers of this temporalis muscle. They will be helping in the retraction of the our temporomandibular joint. Okay, next we have this side to side movement. Okay, so what do you mean by this side to side movement? So what happens is, here if this is the right TMJ, this is the left TMJ. So what happens in this side to side movement is, if the chin has to move towards the left side, the right side's pterygoid, as you can see, I have like stuck the lateral pterygoid, not a very great model, just like that. So we have the lateral pterygoid, right? And we will have the medial pterygoid here. So when they are contracting, what will happen is, at the same time, when right side both the pterygoids are contracting, there is going to be protrusion of the TMJ. We saw, right? Pterygoids means protrusion. Okay. So right side pterygoids are contracting, so there is protrusion. At the same time, left side's temporalis is going to contract. Okay. Temporalis will contract and pull the TMJ behind. So what will happen as a result? The chin, okay, the chin is going to move towards the left side, isn't it? So imagine, here we have, this is the jaw, here we have the lateral pterygoid and the medial pterygoid. When they are contracting, at the same time, when right side's pterygoids are contracting, left side temporalis is contracting at the same time. They are causing protrusion, and the other guy, left side temporalis, is causing retraction. So they are simultaneously contracting, so that the chin is going to deviate towards the left side. At the same time, next movement is going to be, the left side's pterygoids will be contracting, so there will be protrusion, and the right side's temporalis will be contracting, there will be retraction. As a result, the chin will move towards the right side. Okay, so in a simpler way, if I have to tell you, if the lateral pterygoid or the pterygoids, they are going to contract, the chin will deviate to the opposite side. If the patient is going to have a paralysis of these pterygoids, okay, so by default, the chin will not be able to move towards the left side during, if you ask them to move some side to side movement, chewing movements. Okay, so what will happen at that time? The chin will move towards the paralyzed side, because pterygoids are not contracting, so that the chin is not deviating to the opposite side, rather it is deviating to the same side because of the paralysis. Okay, so if a patient is having right side's lateral pterygoid paralysis, the chin will be deviated to the right side. If a patient is having left side pterygoids paralyzed, then the chin will be deviated towards the left side. Okay, so this is how you can check for the lateral pterygoids function. As you know, lateral pterygoid is supplied by which nerve? It's going to be supplied by the mandibular division of the trigeminal nerve. All the masticatory muscles are supplied by the mandibular division of the trigeminal nerve, and this chin position can help you in identifying those muscle intactness. Okay, so this is how side to side movement. So like this alternate movements will happen, and as you know, so if there is going to be protrusion, the action is going to be occurring across this horizontal axis. The axis itself is going to move towards this, whereas for the left side's pulling, I told you, right, the temporalis is going to pull on the left side. For that, there is going to be a slight rotatory movement occurring in the left side TMJ across one more axis, which is a vertical axis passing through this posterior aspect of the head of the mandible and the posterior ramus of the mandible. So number first step, there will be protrusion by the pterygoids, whereas on the left side there is going to be retraction. At the same time, there will be rotation around this posterior vertical axis. Okay, so these are the two axes which is causing the side to side movements. Okay, next, yes, in clinical anatomy, we can have this trismus, and then we can have locked jaw. Okay, locked jaw meaning sometimes this head of the mandible, it might get dislocated in front of the articulating tubercle because of excessive opening of the mouth. Sometimes it would have happened like in yawning, you might hear a clicking sound, right, because it is like hitting the articular tubercle. So in that case, we'll have this. If it is excessive, extreme, it can get locked. So how do you release that? Because it has come in front of the articular tubercle, you're just going to reverse it in the opposite direction. Like you have to depress the jaw, you put your fingers above the third molar of both the jaw, depress the jaw, move it behind, and then again place it above. Okay, so it should be in the same opposite direction, like that motion happened. Next, we have subluxation or dislocation. Subluxation is nothing but an incomplete dislocation. That's called subluxation. And there can be injury to the articular disc also. Okay. And yeah, these are the different clinical anatomy. Here we have this patient whose jaw is deviated to the left side. Okay, this is his resting position. When you ask them to like uh, uh, protrude, the jaw is deviating towards the left side. So which side's lateral pterygoid is paralyzed? You should guess the answer and give me. Okay, thank you so much. Always thank your lateral pterygoid because it is causing the depression. If we are not able to contract lateral pterygoid, we won't be able to open the mouth, right? So if you're not having the rest of the masticatory muscles, we can't elevate the jaw, right, or close the mouth. So we should always be thankful for the masticatory muscles. Yes, thank you so much.